Take Back Your Health Now, Episode 96. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. We are very excited today have a sort of a unique topic. We've got Dr. MARIE Eckel. She is the anatomy professor. She's an author, educator, photographer, and artist. In 2015, Dr. Eckel presented a TED Talk about the value of human body donors in health sciences education. She's currently working on a book entitled Bodies I Have Known, Adventures in the Human Anatomy Laboratory, which is an extension of this TED Talk. Throughout the book, Dr. Eckel educates the public about the human body as told through the stories of the hundreds of body donors who gave their bodies after death for the purposes of education and research. Dr. Eckel has received several teaching honors, including an Outstanding Graduate Student Instructor Award from UC Berkeley, a Teaching Excellence Award from SLCC, and the Atlas Club Award for Outstanding Teaching at WVSOM. She was awarded the Frank L. Christensen Endowed Fellowship from the University of Utah and was named the Betty Cook Karrh Endowed P.E.O. Scholar for 2004-2005. Dr. Eckel currently serves on the board of directors for the Human Anatomy and Physiology Society. Her research is in the field of teaching innovation and educational outcomes research. Dr. Eckel, welcome to the show.
Thank you. Happy to be here.
We're excited. We're excited to have you on board. So this is really an interesting topic for me. You know, I went to podiatry school. We certainly had an opportunity our first year to work on bodies, donated bodies, and it was quite an experience. And I have to say, when I first started, I was very apprehensive because it is strange. You know, it was almost my first exposure to really someone that had been deceased, let alone being with them. I mean, they were literally, when we would walk into the anatomy lab, there would probably be 50 bodies lined up. And I remember the first day, it was scary. It was honestly a little bit scary. And then within a few weeks of it, it actually became somewhat adjusted to it. But I never forgot the lessons that I've learned from that. And even years later, we went back, like we were doing some research on how to make heel pain injections less painful for patients. And we went back into the anatomy lab to do some dissection. So it was really great. And it actually has changed the way I've actually practiced podiatry. But let's sort of dive in. How did you get started? How did you get involved in this area? And we'll go from there.
Well, I came about it in a little bit of an odd way. When I was an undergraduate at UC Berkeley, and my first experience with a cadaver was when I was an undergraduate taking a human anatomy course there, and we had what were called prosected cadavers. So someone else has already done the dissection, and they've done it in such a way that you can take body parts out and you can put them back in, so that you're really demonstrating from a body that's already been dissected.
You know what? I remember that from like anatomy tests where we would actually go around and they would actually have parts labeled, like label A, and then you'd have to figure out what it was. Okay, sure.
Exactly.
Absolutely.
Yeah, and it just so happened one year when I was doing my master's degree there, I was teaching the anatomy lab, and the students who used to do the dissections were no longer doing that. And so I was so fascinated just in general by anatomy that I inquired, who's going to be who are you going to bring in to do the next dissection? And they said, well, do you want to learn? So I said, yeah. And so I spent a summer with one of the students who had these were medical students from UCSF, but the last year they were at Berkeley, they taught me dissection, and then the very next year I had my first body, my dissection, like my very first, let's say, completely clean, undissected, untouched body. And that, it was quite an experience. And I found
It is shocking. It is a little bit, right? It's not something. It takes a little while to get used to, even as a student. I mean, it was for me. It was a little bit shocking in the beginning, and then, like I said, you do get used to it.
yeah, and actually, you know what I did, and it really helped me, was I sat next to the body for a few minutes, and we keep the face and the hands on covered, just because they're really sensitive parts of the body, and when someone's not used to being around a dead body, you
Right.
kind of let them get used to it. So, but anyway, I took the cover off of the face, and I looked at the person, and they always look like very nice people to me, and because they are very nice people, and I just said, I promise to do the best job of dissection that I can to respect your body in death, and and to ensure that others do the same. And that's kind of how I got over being able to do the first cut, so to speak.
Wow. Wow. I just have to say, one thing you talk about, just almost like having that kind of strange experience where you're really looking at a person that's been alive, and they've lived a life, and they were kind enough to donate their bodies and all that stuff. What always threw me was the people that had tattoos,
Yeah.
because I mean, it would really like make you go, wow, there was really someone here that lived an entire life. And it just, to me, it had me connect with him in a way that was somewhat strange. It was, but like you said, these are nice people that have just donated their bodies. And let's talk about that a little bit. How important is this type of donation to the future of medicine, to these students, to anatomy? And how does that also differ from, we've done interviews with Dr. Byrne about organ donation, right? Where people are actually donating their living organs for it. Just, can you talk about that a little bit?
Sure. Well, first of all, nowadays a lot of people think that, um, what's the purpose of doing dissection? We've got all these virtual anatomy programs and such, and so can't we just use those to replace body donors? And a very clear answer to that is no. They're good supplements, but they're nothing like the real thing. Number one, they don't teach those what we call hidden lessons, like what we were just talking about. You have these feelings
Right.
associated with the body, and you're dealing with a real human body, and a physician's going to be dealing with real human bodies. And also, when you have a class full of, say, 20, 30 or more bodies, you don't just dissect the one. You go around and you observe your classmates' dissections. Or in the case of you did some research on the heel, you said? Is that right?
Yes, we were doing it like when I was in school, we were doing injections into the plantar fascia,
Yeah.
which is on the bottom of the foot, and we would do a plantar injection. And what we found, it was too painful. And so what we were trying to do is figure out, how can we do these injections, get the same result less painful. And we found if we went medially, almost along where the posterior tibial tendon, which is a tendon that helps pull the arch up on the inner side of the foot,
Mm-hmm.
the injection hurt a lot less. And so we were in that area dissecting, and we found that there was a pocket right above the fascia that if you put the fluid into it, it would actually spread through that area. So it was important. Honestly, it's changed the way we've done injections. So this is just important to our patients. So I really do understand the importance of dissection. And there's no other way we would have figured that out.
Yeah, and physicians do this all the time. And aren't we glad that you have, a dead body to practice on and find these things out, and not just have to practice on real people with real pain.
Right. Absolutely.
And you get to see the variability. I mean, we all have the same parts essentially, but there's a lot of variability to where nerves can go and blood vessels can go and things like that. And of particular interest to me, as part of my Ph.D., I did something called a cadaver autopsy report that I required of the students. And so,
what is that?
Well, rather than just having students to follow a dissector, which is just a guide to how to do the dissection and what to identify, I actually had visited several autopsies at the local hospital, observed how they did what they did, and I modeled a notebook based on their notes that they take. And so it started with the students when they'd have to make surface observations of their cadaver before they did any cutting. And so they would notice things like the tattoos and scars and things like that. And they would draw them on a body or a picture of a body. And then as we did the dissection, they filled out this notebook. And so, for example, I don't know, if someone asked you what's the size of a normal human heart, what's the typical answer? Do you know?
You got me on that one. I don't know.
You're like, I work with feet. But
you asked me, let me tell you, you ask me how many toes somebody has, I am there. I don't know.
Sorry about that. I'd ask you about the average length of a big toe, but I don't know the answer. So. Well, let me tell you, the answer, the textbook answer, is about the size of your fist.
Okay.
But that doesn't really tell you anything. It doesn't tell you if it's diseased or not. Some athletes have larger hearts. Some diseased hearts are larger. So instead of just, oh yeah, is it the size of a fist? Yes or no? Instead, the students then had to cut through the walls of the heart, measure the thickness of the ventricles, and then compare it to known values. And they could say, oh, this is within normal limits, or this is not.
All right, listen, look at that's how powerful, because you could look at a patient that was obese, let's say, and you could now have a real life example of how that obesity would affect the heart. Or I imagine you probably could look at a bodybuilder and do the same thing and just see those variations. So if that patient were in front of you years later, you would at least have an understanding of how certain physiological reactions to, you know what I mean, how the heart reacts to it. That's great. That's powerful.
Yeah. Well, and the other thing we found is we never used to have these big knives. We just have scalpels, right? But we started cutting the organs in half. And so, for instance, we felt a tumor, or what felt like a tumor, in one body's lungs, and it was like, well, let's just cut it open. And sure enough, there was a big tumor in there. And then in hearts, many times we found evidence of prior heart attacks, because you could even see the scar tissue.
Wow. So these are things maybe or maybe not the patient even knew about.
Yeah. And the best part about it was then we had the local pathologists come in and talk to the students about what they saw, and then took tissue samples and made them into slides. And when they went to their microanatomy or histology class, they observed them so they could see what a heart attack, for instance, looked like at the microscopic level.
Wow.
And it really tied those two courses together. And then what they did at the end, they do a group report where each student may have been responsible for a particular organ, but then they had to put all that information together and guess at a cause of death based on the information. And if it required critical thinking, and they didn't have to be correct, their reasoning had to be good.
Now, let me ask, Doctor, would you have the actual cause of death for that person so that you could compare it to what their answers were?
Yes, and the sad thing about that is I know all doctors in training have been taught to write death certificates, but most don't do it properly. You wouldn't believe how many times the death certificate says cardiorespiratory arrest, meaning they stopped breathing and their heart stopped beating. And that, of course, is how they ultimately died, but there was a reason behind it. And the death certificate should say something like myocardial infarction, which was preceded by, maybe type 2 diabetes, obesity, whatever.
Oh, I got you. So they're just basically putting down the fact that they stopped breathing almost as the cause of death, but there was a preliminary factor to it that wasn't being reported.
Right. And oftentimes oftentimes it's different, very different. And
Wow. So you're really actually like allowing the potential of a future doctor to get better at their investigative skills. Would that be a correct analogy?
absolutely, yeah. And it's fascinating for them. The first year we gave them the death certificate. The second year and years beyond we didn't, and it changed the whole dynamic because they were just so excited to find out, It was a sleuthing sort of thing.
Wow.
Like,
Wow. I remember, and I don't know if you've ever had this experience, and this is 30 years ago, so maybe even more than that, so my memory is just slightly off, but there was a body that was next to ours, and they were dissecting the lung, and they found nodules, and I think it was TB. I think
oh,
it was an undiagnosed, and they actually removed the body. Have you ever seen that, or am I off on that, or is that something that does happen? I remember it vaguely, but I remember that was the rumor that sort of came down, was that I definitely know there were nodules in the lung. They actually removed the body very quickly, and it came down that they did dissection and that it came back as TB.
I wouldn't be surprised 30 years ago, and I've never seen that in 25 years, but now whenever there's a suspected disease like that, or especially prion diseases, those they don't ever put in the lab. In fact, they do special autopsies on them because
What are those diseases?
sorry,
What those be?
like the mad cow disease,
Oh,
Creutzfeldt-Jakob
gotcha. Okay.
disease. Yeah, so because prions being proteins, don't they can spread and cause disease, but they're not fully understood and that kind of thing.
So are there limitations to patients that can donate their bodies? Are there certain diseases where they just won't allow it to happen if they know about it?
Yeah, they're usually it's not so much a disease unless it was be something like TB, but there's generally a weight limit because the body has to fit on a table. And when I was working in West Virginia, that was a little bit of a challenge sometimes. Also, if a person has been in a car accident, they're not eligible.
Right.
And if
Why is that?
I think it's because they have to always do autopsies on car accident victims,
Oh, I got you.
just in
Okay.
case it was a
Understood.
heart attack or something else that caused the accident. Um, and let's see, if you're missing too many parts, if you're, yeah,
Okay.
one limb's okay because you still have another limb for the students to learn from, um, it, but generally it's car accident victims. We don't generally accept bodies under the age of 40 or so. I think the youngest I ever accepted was 35, and that's getting a little bit close in age to the age of the students.
Oh, wow. So psychologically, you think it would have more of an impact on
Yeah,
them?
it's a lot easier to deal with your first dead body when it's someone who's older and you think, oh, they've lived a really good life and then they gave me this wonderful gift when they were dead, and
Right, right.
instead of, oh, they tragically died, and then just feeling kind of funny about it.
Sure, sure. Wow. So let me ask you. So we have interviewed Dr. Byrne about the organ donation. Just can you go over how that differs, and then how would somebody go about donating their body to science? I wouldn't even know where to even start to let people know that that's what you want to do.
Yeah, it's a very different process. So I always tell people when you click that organ donor thing on your car registration or license registration, you are not signing up to be a body donor. So this is something people very deliberately do. You have to find a body donor program. They're usually called a body donor program or a human gift registry or something like that.
Huh.
And there's typically one in every state, if not more. The requirements for one of the requirements for donation generally is that the body has to be within 500 miles of the donor program. So you have to find.
Now these these are at medical schools.
Yeah. Oh,
or
yes.
who would
Yeah.
be like that?
They are at. Yeah, they're
Okay.
typically at the medical school, and so what you do then is, and most of them have websites. So, like if you are interested in, for instance, in Montana, which is my home state, the medical school's at Bozeman, Montana State. So you would go there or go to their website and get paperwork, and requires you to sign the paperwork and get it notarized. And then they actually give you a card when you're all signed up. My mom signed up. She showed me a card a week ago. She said, it's really nice. I have this donor
Wow.
card now. And
Wow.
so then you tell your loved ones, and then basically what happens is then when you pass away, the donor program has someone that comes and transports the body to the morgue, and then they embalm it and then prepare it for whatever it's going to be used for, which most cases is like a gross anatomy course or advanced training for surgeons or anesthesiologists. I've seen a lot of times when people have done injections with dyes to see where their fluids are going. Kind of similar to
Wow.
what
I
you were
mean,
talking
I know
about.
like there's some there's some advanced just surgical podiatric courses where you can go and actually they have cadaver legs and limbs, and we do different type of bunion procedures and surgery in the back of the foot, the rear foot. So even at this stage of the game, 30 years out, we still do courses where we are using,
Yeah,
cadaver parts.
yeah. And we did a full course for orthopedic surgeons. They practiced their techniques for like an anterior approach versus a posterior approach to the shoulder, and they actually used non-preserved cadavers, which was a whole new experience for me, but absolutely fascinating.
What is a non-preserved? What is that? Like, how does that
Basically
differ when?
fresh cadaver, so it's not been embalmed. So we would freeze the parts they weren't using, but then when they did a shoulder dissection, they would basically be able to feel the tissue as it is when the person's alive because it hasn't been hardened.
So it gives you a little bit more of a realistic kind of feel
Yeah,
to it. I
yeah.
understand. Wow. Doctor, how difficult? Like, is there a shortage of these cadaver parts? Are people aware that this is something that is needed? Can you address
I
that?
think more and more people are aware that it is something that they can do that's a great gift to humanity, and they're more likely to do it, especially nowadays than even, say, 20 years ago. And one reason for that is there's been a big movement over the last 20 years or so for these programs to hold memorial services at the end of the year.
Wow.
And
Wow.
those are very powerful. So we typically have invite the medical students from that first year's class, and then the families of the donors that were the people who donated their bodies in that particular year. And it's held in Salt Lake. We held it at the cemetery, and there's actually a plot there for the donor program. And the most interesting part of the whole thing is when there's an open mic session. It's a non-denominational ceremony, and so a lot of the students write poems, sing songs, and this sort of thing. But then people are allowed, both students and family members are allowed to just stand up and say something about their loved ones. And almost every time somebody stands up and says, you know, I really, really disagreed with my mother's decision to donate her body. You know, it was really troubling for me. After seeing the value of what she gave to these students and how much respect they have for those donors and what they've learned, and that these are now these people are now going to go out and be doctors, and probably more compassionate doctors and capable doctors as a result. You know, sign me up. So they do 180 reversal.
Wow.
But
Yes. Wow, isn't that something? Let me, Doc. You're writing the book, "Bodies I Have Known: Adventures in Human Anatomy Laboratory." Just give us a little quick summation of maybe anything that's about that we haven't talked about yet.
Well, so I have worked with donors' bodies in numerous capacities. Aside from doing dissections and teaching with them, I also have done a number of dissections and photos that I use in the textbooks that I write. And
Oh, that's right.
yeah,
You do photography.
and
Yes.
so I feel so indebted to these people, and also I feel like they have such great stories to tell. Like, I was trying to think, I thought of one and then I forgot what it was. But by looking at their heart, or looking at their scars, or sometimes you see a little bit of their history if their family has given you a little bit of their history. And I feel like kind of in writing about experiences in the anatomy lab that we've had, that in telling their stories, it might encourage people about the importance of body donation. It might make people who have already decided to donate feel better about their decision. And just the pure anatomy and pathology that I've learned from working with these bodies, and how variable they are, and some of the things that I've seen that you wouldn't think were possible. Like one time we were opening the chest cavity of a cadaver, and there was this big thing in there, and the students were completely confounded what it was, because it didn't look like heart and lungs, and the heart and lungs were kind of squished. And so I did some digging and eventually figured out it was the stomach. Yeah.
Oh my God.
They had such a large defect in their diaphragm that they didn't just have acid reflux, they had their entire stomach went up through. Yeah.
In their diaphragm.
And
Oh my God. How often would you see something
I've seen
like
that
that?
once.
That's pretty rare anomaly.
I've seen partials,
Wow.
like where just the last part of the esophagus and first part of the stomach's kind of poking up, but this was the entire stomach. And yeah.
Wow.
So,
Wow. Doc, as we sort of wind down our conversations, normally we would ask you what the holy grail of health is. I'm going to just change it a little bit. I mean, I just wonder, almost this is going to be a
that's
little bit of a
okay.
weird question, but from a spiritual one, if you would, when you're seeing the complexity of the bodies and you're seeing these kind of things, how has that affected your viewpoint of life, of spirituality, of however, like, how has that changed you in any way possible?
I think I have just even more compassion for human life and what a gift it is. That I mean, I look at people, just, living people, and I think I see them with problems like walking or, things like that, wearing hearing aids or coughing or just having, I don't know, I feel like I kind of have a little more compassion for the fact that there's something going on in their body and it's not serving them well. And
Right.
but also I just have a pure reverence for the structure of the human body. It's there's a higher creator somewhere that designed this thing, and it's very unbelievably well created in most cases, and in some cases
I have to say that's the same. When I did anatomy, when I saw that, I had the same concept. I said, this clearly was designed. I mean, it's just too complex. It just, that was my own opinion. It was just nothing like this could just come out of nothing. And so it actually gave me, like you said, a great reverence that there is something beyond what we're actually looking at, because the complexity is just amazing.
Absolutely.
Dr. Eckels, I want to thank you for a wonderful interview. As we wind down here, how would people that want to learn more about you, how would they get in touch with you?
Well, I have the anatomyprofessor.com as one of my websites, BOA, and also I have a photography website, ChristineEckelPhotography.com, and you can get in touch with me there as well. Or by email is fine too, which is just christine.eckel@gmail.com.
Dr. Christine Eckel, I want to thank you for a wonderful interview. I really, really appreciate it.
This episode
thank
is
you. It was
sponsored
very
by New
fun.
Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.